Hello, everyone who's joined the webinar. We're going to start in about 1 minute. I want to make sure we get critical mass. Most people sign up for the webinar and come anywhere between 1 and 2 minutes after the start of the hour. So we'll just wait for a minute if you don't mind. You should be able to see my screen and you should be able to hear me. If that's not the case, if you can't see my screen, you might want to just send me a quick question about that. I don't know if I can solve it, but it would be good to know. So I'll join in about a minute. Thank you. All right, everyone. Thanks again for taking the time to attend this webinar. My name is Keith Washington. I'm the VP of Products here at ProSites. And we're going to talk today about 3 ways, maybe top 3 ways you can delight patients online. Before we start the webinar proper, I just want to say thanks again for being here, for everyone who's joined. I want to let you know that we're also recording this webinar, so you don't have to scramble to take notes or make sure that you take screenshots of everything. Anyone who is attending this webinar or signed up for the webinar will get a copy of the recording. I also want to let you know that most of our other webinars are also online on demand, and you can take a look at them by going to ProSites.com. The next thing I want to let you know is that I can not hear you. You can hear me, hopefully, but I can't hear you if you have questions. However, we have a questions pane in GoToWebinar, and if you have questions, you can ask me those questions, and if it's something that I can answer, I will do so during our question and answer period. If it's a question that you have that's related to your specific instance, I will take that offline, but if it's questions that I think the group would want to hear, I'll spend some time answering those questions. And lastly, we usually have a survey at the end of the GoToWebinar that we ask maybe 1 or 2 questions about this webinar. It also always helps us improve our webinars and provide a better service to you. Our whole goal is to help you in your practice grow. So let's get started by talking about the top online ways that you can delight your patients. I want to make sure that you know that this is one of our only goal, help you grow your practice, help you engage with patients so that people know about you, know about your products. A couple of years ago, I remember that I was still trying to convince practices and some doctors that they needed to be online. I have one friend of mine who's a practicing dentist who refuses to go online. But for the most part, those days are over. Most of you already know that having a digital presence is important. Now it's kind of ubiquitous that everyone wants to have a digital presence or has a digital presence, but probably the thing that we'd like to make sure that we talk about today is, are you making the most of what's available in online tools in online presence tools, digital marketing, and patient engagements, tools that you can provide to your potential and current patients. So we're going to talk about how to maximize that. And really, we're going to talk about 3 different areas. Number one, how do you get more patients by helping them easily find and learn more about your practice and its services? How do you increase the number of people who are looking for you? Number 2, how do you help patients remember their appointment? How do you reduce your no-shows by helping them to remember their appointment? And we'll talk a little bit about that. And lastly, we're going to talk about saving time, their time and your time, by helping them prepare for their appointment in advance. And there's some really powerful tools that are available to you and to your firm, to your practice, to help you do all 3 of these things. So first, we want to talk about making it easy for people to find your practice. Even though you may have a website, even though you may have a digital presence, is it the most optimized? Is it the best way for people to find your practice? I think it goes without saying that everyone now is online. Everyone, for the most part, who you'd be interested in, getting is already online. We know that people use Google to find things. We also know that referrals are important, but the data tells us a story of how people use the internet. And it really is important to understand how people are using the internet, using online tools to find businesses, to find practices like yours. Some just quick statistics: 93% of online experiences begin with a search engine. We do this all the time. I hope I'm not saying anything that's new to you, but that's a pretty big number, that 93% of people start by searching something. I don't usually go to a website unless I know it for sure. And even if I do, I just type it in the search engine. 71% of consumers begin their research phase with a search engine. And it's really important to know that we're talking about the research phase. And what I mean by that is I may get a referral from a friend of mine that I need to go see Dr. Smith, because Dr. Smith's a great dentist and it's a dentist in my area. But before I go to see Dr. Smith, I'm going to go online and take a look. Even though I was referred by a friend, even if I just want Dr. Smith's phone number, I'm going to look at their digital footprint. It's because that's the way we think about things now. We are constant research mode, and research is easy and free and almost instant. 41% of clicks go to the top 3 paid ads on search results page. That really speaks to where you're being found when you people search for your practice on the internet. I think we'll talk about this a little bit. Most people, 3 and 4, 75% of smartphone owners are using mobile as opposed to desktop to address their immediate needs. So if I have something urgent that I want, or if I, in the car, or I'm sitting at a stoplight and I need to know where that dentist is, I go to my mobile phone. And then again, you can see 46% of all searches on Google have local intent. It's really important. It means that I am looking for something near me. Almost half of people are looking for someplace near me, and what that means to you as a practice is making sure that you're optimized for local search. So if your practice website is hard to find, then you potentially will lose new patients. It's similar, and you think about that, it's similar to what if, it's so important in getting new patients or getting new potential patients that it should be part of your everyday practice, everyday thinking as a practice. It's like saying, it's similar to if your website isn't optimized, or if you're not optimized on digital. It's like if you have a practice and people can call but no one answers the phone. That would be hard for you to get new patients. Or maybe you're only open for 1 hour per day. You want to make sure that you have the maximum time people can find you in the maximum ways to do that in an online sense. So let's talk about how we do that. First, you want to make it easy for patients, potential patients, to find information about your practice. There's a couple of pictures here that I think are really important, and before we talk about the words behind it, but we looked for dentists in San Francisco, and we came up with this particular dentist, Dr. Bernard Rust. And it's really powerful to see how, before I even go to his website, how I'm viewing this particular dentist. Number one, I see credentials. I see an easy way to find his website because it's right there. Sometimes if I do a search, the website isn't located. If I need directions, I can find it right on his screen. Right there as a button on the screen. He has 31 Google reviews, very powerful, with a 5.0 rating. That's pretty rare for someone to have a 5.0 rating. That means he's trying to make sure that he gets reviews. And if you look through it, some other things, just phone number is clickable phone number, and hours are there. And that has to be current. You'd be surprised at the number of times a practice's hours aren't current, and you don't know if they're closed or opened. But having the hours in that particular box is really important. So I find this to be a pretty pleasing experience even before I go to the website. So when you're thinking about your digital presence, you first of all want to make sure that you claim and have a complete review of your business listings on Google and on Bing. Google is by far the most dominant search engine, but Bing, it's important that you have your listings clear and consistent on your search engines. You might want to consider investing in search engine optimization to help you make sure that you get close to or on page 1 of the Google search, or invest in pay-per-click advertising so that you can be on the top of Google search if you're really trying to drive new patients. Another thing you want to make sure you do is have your social media pages claimed. And this isn't a webinar about Facebook and its dominance in being used as a social platform to find business, but you want to make sure that your social media pages match up with what you have in your website and what you have in your search engines. And then we're going to talk about having a website with clear contact information. So even before I get to the website, I'm making instant decisions about this particular practice that affect my deciding whether or not I'll go with them. In fact, once I do that, I want to click on the website, and you want to make sure that your website is optimized for an ultimate user experience. As I said, most practices have a website today. But what we see too often, even with customers of ours, and our customers can update and upgrade their website for free with us at any time, but even so, a lot of times practices, even though we call them, practices aren't optimizing their website for the ultimate user experience. And so here are some quick tips. I think you have to know that, you know this too, you have 0.05 seconds to capture someone's attention. If your website is bland, boring, you really have to, you really only have a quick amount of time to capture a visitor's attention. Now, they're really talking about potential patients, not people who are returning patients who can't remember your phone number or just want direction. But you really want to focus on making sure you have proper use of videos, images, and making sure that everything speaks to your practice in the most professional way. If you have a photo or infographics, you get 94% more views than text-only pages. That's pretty powerful. So you want to make sure that you select images that resonate with the type of patient that you're trying to get. For instance, if you're located in the city and having a picture with snow on the mountains, maybe that doesn't resonate with your potential patients unless you have some message that you're trying to get. So really focus on making sure that the first impression that your patients have is something that will help them continue on. And I want to be clear, it's not something that you necessarily like, but something that your patients will like. So make sure that you have that professional image, and make sure that that professional image matches what you have on your social media, Facebook page or LinkedIn page if you use LinkedIn. The next thing is you want to really quickly communicate who you are right there on the home page. If you see in this particular image, and these are standard or things that we do as a website provider all the time. But if you really see, it says beautiful natural results, and then in caps, for all ages. And what that says is that I'm focused on helping people with teeth, and I don't care what your age is. And so you have a picture here of people of many different ages. That means you're a general practitioner. You're really focused on making sure that you take care of a wide majority of people. I've seen other practices who focus on urgent care. So if you say words like urgent care on your website, then that will help you get people who have a need, have emergency situations. And we see that. Or if you're focused on restorations, use terms that speak to the type of patient you're trying to get. Not the type of patient you already have, but the type of patient you're trying to get. Don't try to overdo it. Don't put too many words in, because you have other opportunities to put more words in later. But just try to focus on areas that you're trying to quickly say, you're the type of patient that I'm looking for. Next, you want to make sure that people can quickly find the information through a really thoughtfully organized navigation bar. We have customers sometimes who want 25 things on their home page in the navigation bar. And 75% of the people saying, if I go to a website and I'm looking at a website design, how easy is it for me to find the information? 60% of the people say their experience is poor when it comes to looking at a website. So you want to make sure that your navigation is clean. You want to make sure that you create separate pages for each different type of service that you have and showcase your services. Make sure that you're showcasing and making it easy for people to call you, and they can know what your services are, what your specialties are. Most important, probably the most important thing that you want to do is understand what you want someone to do when they get to your website. For most people, this is a conversation about conversion. What do you want them to do when they go from viewing your website, interest in your practice, and converting to becoming a potential patient? Do you want them to call? Then your phone number should be prominent everywhere. Do you want them to fill out a form? Then you should put a form on every page, a contact form on every page. Sometimes some practices just want you to learn more. Then your website should be focused on providing education if you want them to learn more. Maybe you have a complex specialty and you don't want just everyone clicking and calling after 2 seconds of looking at your website. You want them to know more before they engage with you. Know what your goals are. Know what your conversion requirements are, and then adapt and adopt that in your website. Call, forms, those are the most important things, or learn. And you try to make sure that that's all clear on your website. The next thing I want to talk about is content, which is probably one of the most important things that you can do with your website, is making sure that your content helps earn confidence in your patients and helps Google and other search engines rank your website higher. When it comes to ranking against other practices, and it's a competitive landscape, having content that is current, that speaks to the types of things that people are looking for, those are called keywords or key phrases, and is compelling, helps to increase your chances of being ranked high on the Google search engine, and helps people learn whether or not they want to engage you. So make sure that you have informative and interesting content on your website. You don't want to have a 3-page story about something that's a complex procedure on your website, but you want to be able to have them skim the information quickly. You should interleave videos. Our customers, for the most part, use our video library. And if you have a specialty or procedure that you think is important, you provide that video library. And then, as I talked about, making sure that you optimize the content for search engines. It's really important, and that it gets regularly updated and doesn't get stale. Lastly, when it comes to websites, you want to make sure that your website is mobile friendly. I know that some people say that this is wasting time to talk about it, but I have this data. Our company looks at the data, and as I said earlier, even though we will update a website for free, we have too many customers that are still on old styles that if I look at it on a mobile device, just go to your website and look at it on a phone. If it's not easy to navigate on a phone, you're losing potential customers. You're losing potential patients. And it can be easily updated just by picking a responsive style, picking a style that matches both desktop, iPads, tablets, and phone. And it's pretty simple to do. And if you don't do it, you're losing potential patients. So I encourage you to make sure that you do that. So all of this was about how do I help patients have the best experience when they're trying to potentially choose you as a practice. And I think that there's simple things that you can do and really powerful things that you can do to help someone find you. The next thing I want to talk about is helping people make their appointment. 20 to 30% of appointments are no-show. And there are a lot of reasons for that. I actually saw statistics 5 to 50%, but most people say maybe it's 20 to 30% of appointments are no-show. And there's lots of reasons. Maybe I don't have the right insurance, and so I have a complex procedure, and it turns out I don't have the money for it. Or I'm afraid. Fear is a really important thing. Or some percentage of them, and I'm included in that, just forgot. I forgot my appointment. I do recare every 6 months, and I make that appointment on the day of the appointment, of my last appointment. So you want to come back in 6 months? I'll see you on June the 9th. Great. June 9th comes around, and I've forgotten about it. Even if I may have put it in my phone calendar, I have forgotten about it. And if I don't get a call or a text or some reminder in advance, I'm not going to be able to show. Some practices say I have 0 no-shows. And the reason why is because I call them and I charge them a fee if they don't show. And you may do that as a particular practice, but for the most part, and lots of people don't recommend it because I don't want that risk because I'm a busy person, so I may go to another practice. But there's ways for you to help me help your patients remember. And the way to do it is to communicate in ways that your patients want to be communicated to. It's pretty simple. Some people want to be communicated by text, 30%, and that number grows every year. I'll guarantee you by the end of this year, it'll be 40% or more. Prefer appointment reminders by text. Send me a reminder by text. Send me a notification, and then send me a reminder by text. Some people prefer by email. Some people and some practices prefer to call their patients, or they prefer to schedule by phone or online rather than by text or in person. A number of practices use postcards, and it's been successful for some dentists in continuing to use postcards as a reminder. You have to know what your patients want, and it's a simple thing to do. Ask them, how would you like me to communicate your appointment? How would you like to communicate a reminder? And then you can set that. If you use an automated reminder system, you can set that in your automated reminder system. Just really quickly, some benefits and drawbacks for different types of communications. Calls, voicemails, they're really great for two-way conversations. They're really good if you want to make sure that you talk to someone. If you want to remind someone about pre-treatment medications, or if you want them to remember, well, this is a procedure that you can't eat certain things beforehand, you want to call them. You might want to call them. And it really provides that personal touch. If the patient says, oh, yeah, I'm not so sure I can come in, because it helps you overcome those objections. It helps you make sure that you know what issues that they're having, and then you can easily confirm that appointment. Probably the biggest drawback is that it costs you and your practice a lot of time and money to have someone dedicated to calling out appointments for everyone all the time. And when do you call? You call when I'm at work, because that's when you're at work. And so you're going to have a lot of people who don't answer the phone. A lot of people use their home phone in terms of making sure that you, for those of us who still have a home phone, for people to call, and then I forget to listen to it. So you really have to think about making sure that you can automate your phone calls, especially scheduling them after hours, and then ask the patient to confirm them. Text messaging, as I talked about, is growing. It's really best used for notification, automated confirmations, recare, something that is simple for it to do. Our particular solution provides an appointment notification when you make the appointment, a reminder 3 weeks in advance, a reminder 1 day in advance, so that you don't have to do that for you, and you can set those, set the cadence of the reminders so that you can tune it to what your patients want. The benefits of it is really short. People can see the text. If I, like me, forgot the appointment, I go, oh shoot, that's right, and I can make sure that I can make it. I can easily reply to it, or I can text message you back and forth and say, well, maybe I need a different time or a different appointment. Some of the drawbacks is to text do cost money, whether it's for the provider or pass through to the dentist. And not every phone number that you have in your practice management system is the cell phone number. So you have to make sure that you're capturing the cell phone number. Make sure that you really focus on being able to provide text, especially if you have a younger potential patient or a younger audience. Email is really free to do. It's ubiquitous. Everyone has email, but email is best used for talking about your practice. You have a lot more room to send out emails about birthday greetings or information about changes in your practice. Maybe you have a new procedure or a new piece of equipment, or you've upgraded your office. It's really good to use emails for that. Or you can also use emails for appointment reminders. But the problem is that sometimes emails get lost in the mix. I get maybe 300 emails a day. And one of them happens to be my reminder for my dental appointment. I may or may not see that, and I may not treat it as urgent, where a text is urgent, a phone call is personal. So it's best to use email as, maybe you'll use an email as a post-message follow-up to let people know, here are the documents that I gave you. You can send them. Here's your treatment medications. Here are the things that you should watch for. Please fill out a survey. The most important thing is knowing what patients want to be, how they want to be communicated to. So really just ask them about that. And you can automate all of this so that you can save yourself time, make sure that you reach all of your patients, especially if you can reach them in multiple ways, and really reduce no-shows. If you're having more than 5% or 10% of your patients not showing up or showing up late, reminders are really key to helping you keep your practice flowing. One thing I don't like, and most patients, I don't think anybody likes, is to show up for an appointment at your scheduled time and find out that you're 30 minutes late because the person that started the day at 8 a.m. was late, and now everyone else is backed up. So this really has monetary benefits to you and helps your patients feel much better about engaging with you if you have automated communications. Lastly, I want to talk about how you can save them time and save you time and money by helping them prepare for the appointment in advance. Most offices, and I think that we have maybe 85% of our practices, 85% of our practices have online forms. Really what they are paper forms in the office that they put online. Most of them are still using some type of paper form that I fill out. I get a clipboard, I fill it out, and then you scan it into the practice management system, and then you shred the paperwork. But there are many ways that you can make it easy for a patient to fill out a form in advance. I don't like, and most patients, ask them, don't like sitting in an office and filling out a form, and there's some downsides to it. I don't remember all of the information. I don't know, can't remember what the name of the drug that I'm taking for my heart problem is. I don't remember the exact name of it. I'm writing things down. So there's some downsides to having that. So There's some other ways that practices have done this. Number one, a downloadable PDF, and this is what I was talking about. 85% of our customers have a downloadable PDF that allows a patient to fill out in advance, and you send them a note or you tell them on the phone, hey, don't forget, all you have to do is go to our website and you can download the PDF, and I can print it at home. However, I have to have a printer at home. I have to be willing to use my printer ink at home to fill out this form. I still am writing information. And then what do you have to do with it? You have to rekey it into your practice management system. So it does save you some time because the patient has completed this information in advance, but it's still not optimal. A lot of practices have gone to a fillable PDF, so you can download it or you can enter the PDF information online. So I can complete it online and then send it by email. I sure hope it's secure email because I'm sending personal information by email. So you have to make sure that it's secure. Or I print it out and I bring it home, into the office, so I have to make sure I have a printer. Otherwise, I filled out a form and I didn't do anything with it. And if you want to change the form, most companies use, or most of us use, Adobe PDF. You have to rebuild the entire form in order to do that. But this saves time because now I'm typing information in advance, and it does reduce errors. A lot of practices now are moving to secure online forms, and this is the way to really help patients save time, help you save time and get accurate information. So now, by you providing them a link to an online form, you can present the form automatically to the patient, and I can fill out the form, and then the data is captured automatically to the practice. The form can be customized easily. You send it through a secure portal. It's HIPAA compliant, so you make sure that you have that information that's HIPAA compliant. And I can make changes as a patient without restarting the form. So this saves you time, saves the patient time. It reduces the number of errors because I'm typing in information and I'm not writing it in. You're not having to rekey in information that you can't read. It's compliant and it's interactive. What I mean by that is the forms, especially the ones that we provide to our practices, only ask questions that apply to me. I can't tell you the number of times I've had to answer the question in a patient health history form, are you pregnant or have you ever become pregnant? Well, no, but I still have to fill that out. So having questions that only apply to me, understanding who I am, so that if I say I have a history of diabetes, if I answer yes to that question, a powerful interactive form can ask me more questions about diabetes. But if I say no, then it won't bother me with those questions. So really, having a secure online form experience provides a number of benefits. No more paper forms. I don't like filling them out in the office. You can properly prepare for an appointment. A good online form system like ours tells you what your drug interactions are, whether or not they have a critical care issue, and presents that information to the doctor before they see the patient so that you know as a practice what issues you may run into. It's much more secure, it's HIPAA compliant, and it improves the overall patient experience because now this information is saved and I only have to make changes, make updates if something changes. So really, if you think about this quick webinar, this quick discussion, this quick area, there's some really powerful things you can do online to streamline your practice, help potential patients find you. So really, I would encourage you to think about how you can improve your website, improve your online presence to help people find you and learn more about your practices. Consider using automated appointment notifications and reminders by email, text, phone, or postcard, and communicate in ways that are important, that help you reduce no-shows, and then provide an online form experience so that patients can complete that part of the process and save you time in the office and have you with a powerful digital form that you can use to help have better care for your patients all without having them fill out a form in your office. I want to thank everyone for joining this particular webinar. For those of you who don't know, we are ProSites. We are the leading provider of websites and digital marketing solutions and patient engagement solutions for dental practices. You can see here what we offer. If you're interested in any of the tools that I've talked about today, or interested in anything else, or just want to talk to us about, potential ways that we can help, you just call us at the number that you can see on your screen, and always ask about any special offers, especially to those who attend webinars. So I'm going to take some questions. As I said at the top of the call, that you have a little questions box that you can ask questions in, and I'm going to take a look at them. I'll take maybe 5 or 10 minutes to see if we have questions, and if we do, I'll answer them either online or answer them directly to you or to the group. So please don't hesitate to use that area to ask questions. So I have a question. It was a really good question about Instagram. How do you go about easily managing Instagram? And I will talk about that just for a minute. There are a number of platforms that allow. I just want to make sure I can do it. There are a number of platforms that allow. Social media platforms that allow you to engage with potential patients or patients. Facebook, Instagram, Twitter. What we have found as a company is that Facebook by far is the most dominant platform. Instagram is really less and less used as a business platform, and Twitter has some advantages, but it's so limited in its terms. So we focus in all of our efforts in Facebook, including Facebook social media management posting, and that includes digital posting, video posting, to make sure that your presence, that you attract the type of people that you want. And now we've launched Facebook advertising because it's a more cost-effective or cheaper option than pay per click. So the question was, do we manage that service? Absolutely, we do. We provide social media management for our customers. All you have to do is give us a call, and we can talk you through the different options we have for social media management. And it really is another way. Over time, your website will be a table stake. Your social presence will drive engagement, adoption, and of new patients, and engagement of your current patients. I had someone ask about secure online forms. As I said, and maybe I should put that back up on the screen, all you have to do is go to this number, call this number, and they'll talk to you about our secure online patient forms option. We've seen it adopted so well, and really ask them about some of the features, including the critical care summary that we provide to all of to the doctor in advance, rather than just filling out a patient form. For instance, as I talked about, I don't know necessarily the right name of the drug that I would take for a certain condition that I have. Well, in our online patient form solution, we have a list of all the drugs. So if you start typing as a patient the name, it'll help you remember and help you get the right name. So those types of things, something small, but has a big impact on the way you engage with a patient so that you know more about them. Someone asked a question about having payments made on the website, online payment. We do have some integrations with third parties. Please call our number. But really, online bill pay is something that we're working on to make sure that we provide this service for all of our clients. We can integrate a PayPal account today, but we're working with vendors over the next few months to see if we can provide this as a service for all of our customers. And I'll just see if there's more questions and continue to answer them on the phone. I had a question about, is it recommended to have both Google and Bing? And really what that question means is, should I optimize optimize for both Google and Bing? And the answer is yes. If you engage with our company or any company that does search engine optimization, pay-per-click services as part of that service, not as part of a standard website, but as part of that service, we will optimize your business listings across many different platforms. And what that means is, for instance, if you're located in Suite 200, or you have a specific Suite H in a particular business park, for instance, we make sure that that's listed on every one of the business listings, because that causes confusion by Google and Bing. So we provide that as well. Again, call our number. They're really good at walking you through all of the options that you would have for making sure that you are connected. So I'm going to end the recording and end our webinar properly. I'm going to stay online. So for those who want to continue to ask questions, I'll answer them online, and happy to do that. I really appreciate everyone for joining this webinar, and hope that you do a great job this year in getting more patients and keeping your patients engaged. Thanks.